Hi everybody, we are on week 12. For the prompt, after engaging with this week's content, reflect on the role you see interdisciplinary collaboration playing for social workers in health or mental health. I see collaboration playing a huge role between just everything in between. I mean, social workers work closely with mental health professionals if they aren't already mental health professionals themselves. Like my end goal is I want to be a therapist, and I'm going the social work route as well as when I'm done with my bachelor's, I want to do addictions counseling. So I would say that everyone kind of is always going to be working together. Everything's kind of intertwined when it comes to, especially when it comes to health and mental health. You got to think that there's so many different factors that go into someone's care plan or just their goals in general, and we want to have those resources, and we want to be able to talk about different things with these other professionals in order to come up with the best plan or the best outcome for our clients or patients. What do you think are the biggest challenges and opportunities for social workers working in these spaces? I think that the biggest challenges would probably be just kind of keeping up with everything and trying to not only still have those resources, but use them correctly and use them to the best abilities that you can. And also, I feel like it would probably be hard to kind of keep track of everything. I know one of the videos we watched recently, I'm not sure if it was this week, but I think it was, what she was talking about in the video was there's a lot of documentation, and it's really important for us to keep track of everything and make sure that we are, taking notes, keeping track of, appointments or, just everything about our clients, just making sure that we have a good idea of what we're dealing with, and so that we don't lose sight of anything that may become important later if it's not already important in the now. And then as far as opportunities, I feel like there's a lot of opportunities for social workers when it comes to just kind of the scope of everything, but specifically just education, being able to learn how these different professionals work in these different fields, even if it's not strictly social work related. Social workers get to work closely with therapists and counselors and things like that. So obviously you get a bit of a scope in being able to learn what they do and how they handle certain things. And then on the health side, being able to see, physicians' outlooks and psychiatrists and, all of these things, they all kind of just mesh together in order to give our clients exactly what they need, but it also gives us different opportunities in order to kind of open our horizons as far as being able to see what else is out there. Not that we would be looking for a different career necessarily, but being able to see how big this web is that we are all a part of, and being able to use it to our advantage and make sure that our clients are getting exactly what they need. But that's kind of all I have for this week. So I hope you guys all have a great week, and I will see you in the next one.